This is when the dentures fit and the bite registration is checked for accuracy and adjustments are made. The teeth are moved within their wax bases to ideal positions, and the patient is given the chance to see what it'll all look like before they're committing it to acrylic. Infrequently, a new bite registration or a second pickup impression may be needed. These are normal variations of care that should be prepared for at the doctor's request. When everything appears acceptable to the dentist, the case is returned to the dental laboratory for processing. When the finished prosthesis comes back from the lab, it may then be delivered to the patient. The delivery visit is exciting for the patient. Often it is less so for the staff, because of the difficulties in pleasing the patient, adjusting the bite, and the fit of the teeth and the gums and other variables that affect the treatment. Anything from placing the prosthesis without any adjustments to having to start all over again could happen. The dentist must adjust the prosthesis in 2 ways. 3 if it's a partial denture with wire clasps. All dentures' undersides must be carefully adapted flat against the gums, with no pressure spots. For the underside, spray and cream coatings reveal where excess pressure is being exerted. The doctor carefully adjusts the smudge and then repeats the procedure to evaluate the refined fit. Plus, since the prosthesis's occlusion against the opposing teeth must be in balance, the denture teeth must be adjusted to accurately mesh with them. The occlusion is checked with articulating paper and forceps. The denture teeth may be adjusted either in or out of the mouth. Partials also have wire retaining clasps that must be exactly adjusted to the teeth they're shaped onto. The doctor uses special adjusting pliers like those shown here. Depending on the composition of the metal used, they are highly susceptible to breakage, so great skill and care is needed. Never encourage a patient to adjust the partials themselves. The number of appointments from the patient's first to the last visit is variable. The number of adjustment visits depends on the sum success of every single one of the many small steps involved in making the prosthesis, from the preliminary impression, custom trays, the doctor's final impression, bite registration, the postal service's handling of the case, the laboratory's duties, and so on and so on. Be sure to encourage the patient if it seems it's taking a little extra effort to get the proper final fit. Just as a fine piano must be tuned and then fine-tuned a few weeks later, so must state-of-the-art partials and dentures. Once the prosthesis has been delivered and all adjustments are complete, to enjoy it, the patient must simply keep it clean and return for checkups and professional cleanings. Even if they have no teeth left and now wear full dentures, professional follow-up care is encouraged to monitor the health of the remaining gums and the bone. Give the patient your practice's handout on cleaning the prosthesis at home. Only recommend cleaners intended for their use. Never bleach. And last, emphasize that it must be left out, allowing the underlying gums to rest at least 8 hours of every day. Remind them of what happens to the feet if the shoes are never removed. If removable prosthetics add complexity to dentistry, fixed prosthodontic care might sometimes seem impossible. However, the same attention to details throughout nearly guarantees a favorable outcome, one that leaves many patients wondering how they went with missing teeth in the first place. When fixed prosthodontics or bridges are made, the dentist is essentially preparing the adjacent teeth for crowns, onto which the dental lab makes a row of artificial teeth, all fused together. They may be made of porcelain, metal, or a combination that results in the strongest appliance possible. When you consider that up to 200 pounds of chewing force can be exerted on a bridge, it's amazing that something made out of porcelain can take it. Since fixed bridge work incorporates preparing teeth as if for crowns, all of the elements of the restorative aspects of dentistry come into play. The film on restorative dentistry explains the process of crown placement. In summary, first the teeth to be treated are anesthetized. The color of the porcelain to be used is then chosen using a shade guide. Then, to facilitate making the temporary, an alginate impression of the treatment area is made while the anesthetic is taking effect. The impression is then set aside in a sealed plastic bag with a damp paper towel within. Once the teeth are prepared, this impression can be filled with acrylic and placed back on the teeth, recreating their full anatomy in acrylic. The dentist relies on diamond burrs and the high-speed handpiece to effectively and efficiently prepare the teeth for the bridge. Carbide burrs may then be used to refine and finish the preparation. In order to place the edge of the porcelain just at or slightly below the gum line, the doctor tucks a small segment of cotton retraction cord, impregnated with epinephrine or some other chemical, around the treated teeth under the gum line. After a few minutes, the gums shrink back temporarily, and the dentist can refine the tooth preparations a little bit lower. And then, an impression is made of the treated teeth and the spaces where the replacement teeth will be placed. Some dentists use plastic stock trays. Others choose to use a custom tray, like that shown here, which helps ensure accuracy and reduces the amount of impression material that's needed. Next, a bite registration is developed. A small ball of soft acrylic can be used. The dentist places the doughy material onto the prepared teeth and has the patient bite down onto it. After it sets, place the acrylic in hot water to quickly harden it. Before mailing the materials to the dental laboratory, make sure that you disinfect the impressions and the bite registrations as we mentioned earlier. The temporary can be made by the dentist or the assistant, depending on the laws in your state. There's really no one good way to make a good temporary. A technique slightly different from the one described in the restorative film involves simply adapting a roll of soft acrylic onto the teeth that are prepared for the bridge, and then having the patient bite down onto it as they normally would, and even grinding the teeth to adapt the chewing surface. Then, the nearly set temporary is carefully removed and set back on the teeth several times, and finally it's removed and placed in hot water for curing. Afterward, you can trim to the penciled margins and shape the biting surfaces of the so-called crowned teeth to properly bite against the opposing teeth. Be sure to evaluate the bite with articulating paper once you're done. After the doctor has checked the temporary's fit, you may cement it using a temporary cement like Temp Bond brand. Take care when using anything stronger. If the prepared teeth are very parallel, it may be extremely difficult to remove the bridge when the time comes to cement the permanent one. Once the completed bridge is returned from the dental lab, the patient may return for the final appointment. Some practices prefer to try the metal framework in before committing to the intricate process of applying the porcelain. Depending on the patient and the dentist, the teeth may or may not be anesthetized before cementing the bridge. After the temporary is removed, the excess cement is cleaned from the teeth and the bridge is then tried in. The dentist adjusts the underside of the bridge if needed for it to completely seat, and then the occlusion is corrected. Once refined and acceptable for delivery, the finish is restored, polished if gold and reglazed if porcelain, and then the bridge can be final cemented. Many dentists exercise an element of caution and temporarily cement a bridge for a time before committing it to a final cementation. When the bridge is ready to be final cemented, the previous steps are repeated. The permanent cement is extremely strong, so the bridge should not be considered removable once this step is completed. The same permanent cements mentioned in placing crowns can be used with bridges. Cements with longer setting times may be preferred, giving the doctor extra time to place the various retainer parts of the bridge onto their respective teeth. Remember to mix the cement as directed and load an adequate amount inside each tooth. After the dentist places the bridge in the mouth, He'll often have the patient bite down on a wooden stick or a cotton roll, or he may decide to hold it in place himself until the cement is set. The tray setups for the 4 phases of fixed bridge work are, first, for the crown prep, it includes everything that was on the crown tray, plus a larger mirror if available to evaluate the draw of the 2 preps, or how close to parallel the 2 teeth are. The next tray is the impression treatment tray, with the custom tray and the impression materials. The third tray is the temporary placement tray. And finally, the tray with everything needed to deliver and final cement the bridge. You won't find a doctor who will treat a patient without first consulting current x-rays. X-rays to the dentist are like what radar is to a pilot, flying in clouds or in the dark. Usually a full mouth series, with bite wing films and sometimes a panaural radiograph as well, will be made in the course of planning the patient's treatment. These should be on display in the treatment area for the doctor to consult if needed. The film on taking dental x-rays details the entire process. In brief, when making films, be sure to follow these simple guidelines. Always use a film holder or some form of positioning device. Center the film behind the teeth to be x-rayed, at least 6 feet back from the tube head, preferring to stay behind it. And finally, always use a lead apron on every single patient that's being x-rayed. Successfully replacing or reconstructing missing teeth is dentistry's biggest challenge. Still, these will be among the most satisfying days you'll spend with your patients. Know your roles in participating in prosthodontic care, and by taking maximum advantage of your allowable duties, you'll come to know the full rewards of what dental assisting really is. When people live more enjoyable lives because of something that you've done for them, there's no doubt that you're an important part of a very honorable profession.